This podcast is brought to you by StoryNight, an independent strategic communications firm that drives business results through the power of storytelling. StoryNight applies talents of Hollywood TV writers, journalists, and authors to craft compelling stories for athletes, executives, politicians, entrepreneurs, and businesses. Whether you're an NFL player trying to reinvent yourself for a post-playing career, a startup seeking investment, or an executive trying to upskill your sales force, StoryNight can help elevate your communications and drive the decisions you're looking for. To learn more, visit the StoryNight website at story-night.com. And now, onto the show.
A 17-year-old girl in Los Angeles who was scheduled to have a liver transplant. But just before the surgery was to start, the surgeons took the parents to the side and said, "I'm sorry, but Cigna hasn't given us clearance to go forward."
Welcome to The Career Circus, the Story Night podcast that uncovers crazy career stories. The stories that you tell your friends over drinks that are too wild, too funny, or too awkward to keep to yourself. This podcast is where we bring these stories to life. Each week, we are joined by esteemed guests, champions from the realms of politics, commerce, governance, sport, and media, who are bold enough to recount their most unbelievable feats and fumbles. From surprising stumbles to hilarious misunderstandings, we venture forth to explore the lighter, stranger side of one's professional quest. So get ready to be shocked and tickled, because this is where career paths get truly entertaining. And today, we're joined by an American hero, Wendell Potter. Wendell went from running public affairs for health insurance giants Humana and Cigna to blowing the whistle on health insurers and advocating for meaningful healthcare reform. He's appeared before Congress to offer expert testimony on health insurance in the US and reveal the business practices and propaganda tactics that contribute to spiraling healthcare costs and the growing number of uninsured and underinsured Americans. He's spoken at many public forums, written op-eds for the New York Times, Washington Post, and authored 4 books, including the New York Times bestseller, Deadly Spin. Today, he leads the nonprofit Center for Health and Democracy and the Lower Out-of-Pocket Now Coalition, an organization that advocates for health insurance doesn't leave families buried under mountains of medical debt. He's also the publisher and executive editor of Healthcare Uncovered, newsletter on Substack, and he joins us now from Philadelphia. Wendell, thank you so much for joining us.
Oh, it's my pleasure. Good to see you.
So your career is fascinating. Normally, I like to ask guests about a plot twist, but we've known each other for a while, so I'm familiar with the plot twist. But before we get there, you spend a lot of time in PR for health insurance firms. I imagine the amount of spin that was needed to present these organizations as not evil was immense, and that lent itself to some odd moments. Were there some really crazy stories from your time as a PR exec?
Yeah, it was. And I've often said that my title was Vice President of Corporate Communications, but I was really Vice President of Propaganda for these companies. And it was quite the ride. A lot of drama throughout my career, some dark humor, but plenty of times when it just was too crazy for anyone to believe on the outside. I often didn't tell people what I did for a living because insurers are not very popular over here. And everyone, even when I was in the industry, despised these companies. It's gotten even worse these days, though, far worse.
Did you find yourself in a position where you thought, we can't spin our way out of this one? Or did that never happen?
You know, I was always able to spin it away in one way or another. There was one final event that was too much and was my impetus to leave the company. But even when you have this even long-running PR crisis, the mentality is, well, let's just hunker down. We'll get through this. And eventually the media will tire of this story and we'll go back to the routine. And that's always been the case. These companies are always able to do that. And I don't know that that's forever going to be the case. I'm hoping not, or I wouldn't be doing what I'm doing now. But yeah, spin works. I can attest to that. I was a pretty good practitioner of it.
The cynic in me wants to say that these companies are correct, that eventually the news cycle does move on. And we're seeing that not just with healthcare, but just any number of issues. For example, if there's a lot of Epstein chatter around Trump, he deploys the National Guard and suddenly no one's talking Epstein anymore. And that's not to go after Trump. It's just a very foolproof playbook that anyone can deploy.
Yeah. It's true. It's true.
And so you alluded to this a few minutes ago, but what was the inciting event in your transition from being the propaganda guy to where you find yourself today, an advocate for meaningful healthcare reform?
Well, one thing that is a feature of U.S. healthcare and U.S. health insurance, increasingly so, is that insurance companies insert themselves between doctors and their patients in very important ways, to the point that it's not a fabrication or a stretch to say that these companies actually operate death panels within the corporate halls of these companies. There's one practice that's referred to as prior authorization, which means that doctors have to get approval in advance from an insurance company before they can proceed with a treatment, with a surgery, or even to prescribe certain medications. And increasingly, the insurance company says no. And often they'll say we don't have the right paperwork, but sometimes they will just say we're not going to cover this because we don't think it's medically necessary. And that happened in the case of a 17-year-old girl in Los Angeles who was scheduled to have a liver transplant. Indications were that Cigna was approving it, to the point that the surgery was scheduled. The girl was actually at the hospital, but just before the surgery was to start, the surgeons took the parents to the side and said, "I'm sorry, but Cigna hasn't given us clearance to go forward." And the family, I heard from the family later, I got to know them. What does Cigna have to do with this? They didn't have any idea that this is a part and a growing part of U.S. healthcare. But the surgeon says, unless you've got $72,000 that you can pay down, that's not the full fare, but we would need that to proceed. And the family didn't have that kind of cash. They did decide to make a big stink about it. They appealed that denial, but Cigna wasn't budging, so they made a big PR nightmare for Cigna, getting local publicity, news coverage in Los Angeles, but it spread all across the country. It was an international story for a little bit, to the point that Cigna finally decided this is too much of a PR problem. Let's try to make it go away. And a decision was made by the CEO days after the surgery was scheduled, but after the publicity had gotten so bad, he made a decision that the transplant would be covered. One of my jobs was to try to make sure the family knew that, because the surgery could have been scheduled right away. The problem was, in fact, I was watching it on TV. It was CNN was covering the family was staging a protest in front of Cigna's regional offices in Los Angeles. And I could see on TV that someone had come and whispered into Mrs. Sarkeesian's ear, the patient, the girl, her name is Natalie Sarkeesian. But it doesn't have a happy ending. I thought briefly that I had helped maybe save a life, but a delay of a few days can be lethal, and it was in Natalie's case. She had gotten sicker. There actually was no waiting liver to transplant, and she died just about 5 hours after Cigna said it would cover the transplant. And I just couldn't do that anymore. I'm a father myself. I had kids, now have grandkids, and I could just imagine what the family was going through. And I, pretty soon after that, turned in my notice. Throughout my career, I had handled countless, we call them horror stories, inside Cigna and inside the industry. And even the media started using that during these and thousands in this country to describe these cases in which people just were not getting the care that they needed because an insurance company was stopping it. And I walked away. I just didn't have it in me to continue to defend an industry that did that has the ability, has the power. Even, and keep in mind, the family had paid premiums, and the family's employer, the father's employer, had paid premiums. You're going to get the care that you need in America.
Yeah, it's tragic. It's very moving. It's damning. If I'm hearing this correctly, it sounds like when Cigna makes that decision, in this case, the CEO got to make a decision, and he did that in response to bad PR. But even if it didn't escalate to that extent, it sounds like the decision is made based on P&L, and Cigna's not necessarily asking its own doctors to make a judgment. It's just saying we don't, because when you say it's not medically necessary, that implies some kind of medical judgment, but it seems like it's just about profit.
It's exactly what it is. And yeah, the CEO is usually not aware of these cases. It was a very rare occurrence when I would need to elevate a situation to the CEO of this nature. because my team and I were pretty successful in batting them down, making them go away, making it be a one-day story if it was a story at all. But you don't need to have a memo or anything like that that instructs the medical directors to not approve X number of requests in a given period of time. It's understood as part of the corporate culture. Regardless of what your job is in one of these big corporations, that you have to do your part to make sure that the company is meeting Wall Street's profit expectations every 3 months. It's that simple. And I know this because another thing that I did was handle financial communications. My name was on Cigna's earnings reports for 10 years, and I was helping to write the press releases, handling all the calls from reporters when we had announced any kind of financial disclosure. And I knew where the money came from, what the company did with it, and the allegiance that the company has to shareholders and a handful of Wall Street financial analysts. Those are the true masters of these companies.
And if we unpack that a bit further, it's to please Cigna's shareholders, which is typically institutions, hedge funds, to Vanguard, for example.
Yes.
And so it's not, retail investors who care about these because they just don't own enough of the slice of Cigna. So to appease, let's say 3 or 4 big shareholders of Cigna, essentially people are dying.
Yeah, exactly. That's exactly the way it is. And you're absolutely right. All of these companies are owned by institutional investors. And of course, what Wall Street financial analysts who cover the industry write, that's important for these companies. Those analysts have direct access or easy access to the CEO that reporters and everybody else never has access to. So that just tells you what's important for these companies, who they talk to, who they listen to, and who they take direction from. And they take direction one way or another from those shareholders. If they're not pleased with quarterly results, then the C-suite in these companies swing into action. And that goes downstream. Everybody knows you've got to do what you need to do to make sure this next quarter that you're getting the earnings per share number where Wall Street expects. You're getting the medical loss ratio in line with the street's expectations. That's the game.
Which is pretty damning. But as damning as that is, I really want to thank and commend you for blowing the whistle as you did. It takes a lot of courage to do that, especially because there's an Upton Sinclair quote, which is words to the effect of, it's very hard to get a man to understand something when his livelihood depends on him not understanding. And so it's quite easy to argue that you fit that description of your livelihood depends on you not understanding until you had this moment. And with this case for this tragic death of this 17-year-old in LA, what has life looked for you since you blew the whistle? Because typically when you blow the whistle, nobody wants to know you in the industry and your employment prospects plummet. How have you found being a whistleblower, and what surprised you? Who has embraced you? And then what are some of the downsides?
I almost didn't do it. I was more or less kind of pushed into doing what I did, becoming a whistleblower. It was terrifying because I had been a part of efforts to discredit industry critics. And I know what you said is absolutely true as well, too. You also are just burning bridges. You're not likely to get any job offer, certainly in the industry, but from any big company. They're just not going to hire you. It's just not going to happen. But my crisis of conscience really was so compelling to me. I couldn't not do it ultimately. I felt that I might never have another opportunity in my life to make a difference and wasn't sure that would be it either, but I decided I had to actually do it. I've been surprised. You always think of these worst case scenarios when you're making a big decision like that, and truly it is life-changing. And I think that's one of the things that holds people back, just the fear. And you're also right. You've got a mortgage, you've got kids in school, and credit cards maxed out. So that holds a lot of people back as well, too. But I was fortunate. I think the reasons why I've been able to continue doing what I'm doing and piece together a livelihood is that, first of all, I know the media. I'd worked in the media throughout my career, and I was a reporter before that. So I had a lot of relationships with reporters and understood media, and that was helpful to me. A lot of people who might do what I did, if you don't have that kind of an understanding of how to work with and deal with the media, that can be unnerving. But I also testified before Congress the first time out as a whistleblower. I had covered Congress as a reporter years earlier. I was a journalist in my first career, so I was familiar with the setting. I was intimidated by it. I had reported about hearings many, many times over the years, and had even supported our lobbyists when I was at Cigna. This is what you need to tell these guys to get them to believe. But I was familiar with it, and so that was helpful. The other thing is I was telling the truth, and I was not necessarily disclosing anything that I think Cigna or Humana would feel was proprietary. I was talking about what were industry-wide practices. It wasn't specific to Cigna. It wasn't specific to Humana. I worked with my peers across the industry, so I knew that we were not out of step with business practices and PR strategies that were used by the other companies. That was all helpful. And then the media kind of, they flocked to me. I did lots of interviews, but one in particular was especially meaningful. It was by Bill Moyers, who recently passed away, was just a saint. He had worked in the Lyndon B. Johnson administration as Johnson's press secretary, was a principal in starting the Peace Corps. He went on to have a wonderful career in the media on PBS, and he invited me to be on his show. And that happened. I wrote Deadly Spin, my first book, and it just began to be something that I realized I could make a living doing this somehow. I knew I was not and wasn't expecting to replace my corporate paycheck. One friend of mine told me when I was waffling and talking myself out of doing this, he said, well, Wendell, you can at least push a broom. And I realized, I may not be a corporate executive, but there are other things I could do that probably pay me less, but I'd sleep better at night. And I have.
On behalf of 330 million other Americans, thank you very much for doing that. I think the country is better off that you've done it, and thank you for staying in the game, because I imagine there's plenty of reasons that you might want to throw the towel in at any time, especially because, as you touched upon it, like testifying before Congress can be nerve-wracking. You're under oath. And now clearly, as you mentioned, you've got the truth on your side, which is really helpful. But what is it like to testify before Congress? Is it a circus? And I ask because sometimes when I watch congressional testimony, I'm thinking, okay, this is a really good line of questions. For example, Josh Hawley, when he was grilling the Boeing execs not long ago, I mean, I'm no Josh Hawley fan, but I support his line of questioning. And other times, senators look completely inept, like John Kennedy. When he's on, I'm like, what? And John Kennedy's not stupid. He's a very intelligent guy. I think he plays an idiot for TV. But sometimes Congress looks inept. For me, as somebody who's never testified before Congress, what is it like to testify before Congress in your experience?
It is like a circus. It's like you often see on TV. I just watched the series called The Residents, which is kind of funny. The plot involves a murder in the White House, and there is a Senate investigation or Senate hearings, and Al Franken plays the chair of the committee. It's similar to that. You have senators who are posturing. They will come in and out of the hearing. It's controlled by the chair, and the chair is controlled by whichever party is in control of that House of the Senate or that House of Congress. And you just never know if you're going to get rude questions. I call them rude questions. I used to staff the CEO, and we'd put together these hard questions that could come up. So you prepare for that. You prepare for questions that come in from left field or just clueless but still mean-spirited. That hasn't happened to me. I've been grateful for that, because I think members of Congress on both sides of the political aisle over here think that they get what I'm saying. They hear from their constituents that things are really, really bad with our healthcare system. So they've at least listened. I testified before Congress in late July before another Senate hearing. It was a Senate Health Committee, which stands for Health, Education, Labor, and Pension. Bernie Sanders is the ranking member of that, which means he's the top Democrat on that committee. Or actually, he's an independent. He caucuses with the Democrats. But it feel like you're in a show. You feel like you're in a drama. It really is like that, and it really is.
Did you get any oddball, rude questions as you described when you testified?
No, I didn't. Although one time it was after the 2012 elections, the Democrats lost badly after the Affordable Care Act was passed, and the Republicans took control of at least the House, and I think the Senate as well too. I was called to testify before a House committee, and there were a couple of women legislators or members of Congress, one from Tennessee, one from North Carolina. They gave me one heck of a hard time. They were really deep in bed with the health insurance industry. I know this from having worked in the industry. We always knew we had some go-to members of Congress that we could always rely on to carry our water for us. And I was up against the two of them. One of them asked me this odd, bizarre question. Mr. Potter, do you have a mother? I, to this day, do not know exactly where she was going with that question. I think she was trying to make me be seen as someone who couldn't possibly have been raised right. It was bizarre. So you encounter that. One thing you've got to understand and go into these is that a lot of members of Congress are indeed really close to industry groups and corporations. They will do and say things that are handed to them by lobbyists for these companies. And you know that going into these kinds of situations.
Yeah, but I think the lobbyists and the efforts of Humana Cygnus PR departments is really effective. And I say that for a few reasons. So firstly, I lived in Manhattan for a number of years. And when doing so, I gave a speech alongside a state senator in a church on the Upper West Side, and I had to explain to the audience, and I was talking about universal healthcare, which is the norm in Britain, which is where I'm from. And I had to explain, with universal healthcare, you get to see whichever doctor you want, because the PR efforts are so effective in the US that people think, oh, you don't get to choose your own doctor. Like, you can change your doctor whenever you want, if you want. I don't know why you'd want to do that. It makes sense to go to the local doctor. But this idea that universal healthcare robs you of choice is a complete fallacy, firstly. And then secondly, the two other examples. I try not to debate this with my coworkers in New York, but at the Christmas party, it would come up. And one of my coworkers said, I like our insurance. I want to keep everything the way it is. I like our insurance. And I'm like, you're not quite getting it. And the last example I want to share is this was August 2020, shortly before the 2020 election. I was out to lunch on the near Lincoln Center at Smith's on the Upper West Side with my friend and his wife. And I was saying, Biden doesn't go far enough on healthcare. I think he needs to go further and offer universal healthcare. I said, look, I'm from the UK. I know how flawed universal healthcare is, but it's better than the alternatives. And my friend's wife turns around and says, and mind you, these are all Democrat voters living in deep blue Manhattan. My wife's friend turns around and says, yeah, but how will insurance companies make money? And I'm thinking, I don't really care how they make money. That's not the point of public policy. But it demonstrates to me how effective the efforts of PR firms are that Democrat voters would come out with that line, which suggests there's a lot more work that needs to be done to undo that.
Yes, there's so much work. And that is, again, why I stay at this, because I think it's important to hack at that. And I do. 2 or 3 things are going on. One, my former colleagues and I are very, very, very good. We know how to get people to believe things that are not true. We know how to use language to get people to respond the way we want them to respond. We get people to believe that they've got that competition is good in health insurance, and that there actually is competition in health insurance, that they have choice. People have bought into this because of many, many years of propaganda. And the other unfortunate thing is that Americans are just clueless about other healthcare systems in other rich countries. Information is available, but my former colleagues and I spent years and years, and it's ongoing, to try to discredit other healthcare systems. I mentioned earlier, we work to discredit our critics, but also to try to get people to believe things that are just simply not true about other healthcare systems. And we grew up with this system. We don't know different. We're not really aware of the fact that other developed countries have universal coverage, spend far less than we do on healthcare, and have better outcomes. There's this thing, I'm sure you know, of this belief in American exceptionalism. How could any country do anything better than we do in anything? So you've got that going on as well, too, plus the worship of Wall Street. You got a lot of that.
It's very frustrating, I think, as an American, because America is exceptional in many ways, in a positive, also in a negative way. So, for example, not long ago, life expectancy in the US was going down, which is an undeniable fact. But it seems like that fact hasn't kind of resonated enough with enough Americans to result in legislative change, which leads me to believe that more effective stories are needed to help through. What kind of stories do you think we need to tell that aren't being told to move the Overton window to get to a place where we can have a good conversation about universal healthcare? Because one key distinction between living in London and living in New York is in London, no one's debating should everyone have universal healthcare. It's just accepted. Everyone has universal healthcare. Maybe we could improve the service. Maybe it's got flaws. But in the US, it's still a debate, which is baffling to me as a European. But what stories, what are we missing? What stories do we need to tell?
I think we need to tell the stories of individuals and families who are so disadvantaged, who have a crisis like the Sarkeesian family in Los Angeles. They happen all the time. It's only the ones that rise to the level of really getting the media's attention that people ever hear these stories. They aren't frequent enough. In the 90s and early 2000s, the media was more aggressive in covering and telling those stories. We've had a problem with the way the media has changed in recent years as well too. But to get to your question, I think it really is telling individual stories, personalizing the hardships that people face, the frustrations, what happens when someone is denied care that they need or have to spend so much money out of their own pockets before their insurance kicks in, which is another defining feature of U.S. healthcare. Not only do we pay lots of money, but we have to pay a lot out of our own pockets in addition to our premiums before our coverage kicks in. It's insane. Reporters know all this, but they too grew up with this system, and the system becomes wallpaper. So you've got to do something that changes that. And I think it is ultimately storytelling in various ways, probably small chunks. I have a newsletter, and we do some of that. We're going to do more of that. We're going to do some videos. We're going to do a lot of things that are broadly in storytelling. Our healthcare system is so damn complex. I've often said it makes your hair hurt. I've tried to explain it to audiences in the UK and Canada and elsewhere. People just look at you like you're crazy. What are you talking about? The language you're using, just the term prior authorization. Not even most Americans know that until they confront it. So too often advocates resort to wonky language. That's another problem we've had. Advocates who have pushed for healthcare reform in the past have not understood the importance of effective storytelling. They get in the weeds, the policy weeds. You can't do that. And for certain audiences, you can, but small audiences that live in that world, most Americans don't. Most people don't. So you communicating with them different.
Well, the one thing I try to emphasize when I teach storytelling through Story Night is smart people use simple language. In the UK, in 2019 election, Brexit by most independent economic measures was a disaster and remains a disaster. But Boris won the election by a very simple message. Get Brexit done. Work. Or even if you look at like politics, make America great again. It works. You can debate, the validity of the message. Simplicity is the ultimate sophistication in many occasions.
It is. And I know that. And that's what I strive to do. For someone, our opponents, when I say our opponents, the industry, they've got it down cold. They know how to get their politicians to use talking points that are very simple and that scare people. Their talking points, their messaging is always fear-based, getting people to think they're going to give something up if reform passes. That's how you communicate with people, and you can use simple terms. But I think advocates for reform get lost in trying to explain the complexity of our system. They get lost, and it really is hard to come up with a pithy phrase or two to advocate what you're for that really resonates with a diverse population. But we got to do better than we're doing now. There's no doubt about that.
The irony is that Sarah Palin talked about death panels when Obama started talking about what is today the Affordable Care Act. It's ironic because death panels do exist, but this, as you described when we started this interview, within insurance companies determining who should get insurance coverage or not based on profit, not based on medical need.
Exactly. It was tragically ironic, but so incredibly effective. Not a single Republican voted for the Affordable Care Act, which was being debated at that time, which was during the early years of the Obama administration. And so many of them went up to the podium, either in the House or the Senate, and talked about the fact that this legislation would create death panels in the government and that it would destroy our healthcare system, that it would lead to socialism. That's another term that the other side, the industry's followers and lackeys have used to try to scare people. And in the past, it's worked to get people to think that anything that's not like our system is somehow socialistic. And in much of America, that's a red flag.
It is. But at the same time, it feels like the level of frustration today is probably higher than it's ever been, as evidenced by the assassination of Brian Thompson in New York City in December of 2024 by Luigi Mangione. Now, as reprehensible as that was, I think it's unforgivable. Like as awful as health insurance is, you just don't take the law into your own hands in a civil society.
Unforgivable.
Absolutely. Having said that, what stood out to me was a couple of things. One is the fact that Mangione came from a pretty upper middle class background. I believe he went to UPenn. He had his parents had membership at the country clubs in Maryland. In addition, and this part is maybe a little bit more predictable, was that Wall Street learned all the wrong lessons. The reaction was, we need to invest in physical security of our offices, bodyguards, etc. The lesson was not, wait, why is this happening? Have we contributed to the problem? If so, let's do something about it. And so it feels like the wrong lessons were learned. Nothing's going to be done. I haven't seen anything meaningful since the tragic assassination of Thompson. But what do you think comes next, given we're at this kind of inflection point where people are literally being killed in the street in broad daylight in relation to health insurance?
You're right. I was shocked at the murder, but I in hindsight, wasn't shocked at the reaction. And so many Americans went on social media to cheer on Luigi Mangione. And when I say I wasn't surprised, I've known that this outrage, this seething anger has just been right below the surface. That was an event that triggered a lot of people just to start speaking out about their own frustration with this system and telling their own stories. I've done so much media interviews since that murder last December, and I've learned some things. I'm trying to figure out, are there ways to channel that outrage, channel that anger from average Americans? But Wall Street, like you said, has been very tone deaf, and what they respond to are numbers. And what we have seen is United has had a really, really hard time on Wall Street, and all of the other companies, Cigna, Humana, and the others, have really had a very, very bad year financially. And it's because the things that they do that keep us from getting the care that we need isn't working like it used to. I mean, there are some people who actually do manage to get care. Sadly, many of them are going to the emergency room because they've delayed getting care in more appropriate settings, and that's very, very costly. So Wall Street is beginning to question whether these companies are truly able to continue on with their level of profitability. But United has lost more than 55% of its value, the shares have, since this time last year. And most of that has been since the murder of Thompson. One of the things that did was at least get the media and policymakers to pay more attention to how that company is structured and what its business practices are. And that's been a lot of the work that my team and I have done too. We released a report in July that kind of the structure of that company. It comprises almost 3,000 separate entities. And it's just mind-boggling, the breadth of that company. And it's getting increasingly into healthcare delivery and has international operations, including in the UK, and they have for a long time. It's a monster of a company, but even the Trump administration's Department of Justice is investigating the companies. The companies are under, United in particular, but the other companies as well too, are under scrutiny like they've never been before, even far more than during the Obama administration. So, that gives me some hope. I'm not necessarily an optimistic person, but a hopeful person that the work that we're doing and the scrutiny that these companies are getting is seeping through even to the public in ways that we haven't seen before.
Exactly, which is why, as you mentioned, a Republican administration is asserting the DOJ's authority over this. That as powerful as the DOJ is, to get a company to break up it's very unusual. And even if that is the recommendation, often never sees the light of day because it gets litigated through the courts, etc. And this remains a problem. On that basis, do you think states like New York and California should pursue universal health care at the state level rather than waiting for Congress to get its act together? Or do you feel like the ultimate solution to this is a national universal healthcare program or something else?
Yeah, I'm agnostic as to which is the best route to take. I was at a press conference with Congressman Ro Khanna a few weeks ago He's a California congressman. He represents Silicon Valley. But he has introduced legislation that would make it easier for states to move toward a single-payer system, have their own universal system of health insurance. California and New York have tried it, but they've never been able to get across the finish line. And part of the reason is because of obstacles at the federal level. We have a very unusual system in which we have a Medicaid program and a Medicare program, Medicaid certainly being for low-income individuals. The states have to get waivers from the federal government to be able to do that. And then you've got this whole problem of big employers having protection by federal law that was passed in the 70s that gives them even immunity from state regulators. It's bizarre how our system is bifurcated and structured. And so that bill that I mentioned, Ro Khanna's bill, would make it easier for states to clear some of those hurdles, get permission from the federal government to move forward. But you have the problem at the state level you have in Washington too. You'd think most Democrats would get it, would be on board with moving in that direction. But many of them are in the pockets of the insurance industry as well, too, and other big corporations. I think it's possible. It's worth trying. I've supported efforts in California, or I've talked to advocates there, New York, all over the place. It's possible. In Canada, the Canadian system started at the provincial level in Saskatchewan, and other provinces paid attention, and ultimately so did Ottawa. But it's a hard slog to do it that way. But it's hard to get Washington to move in that direction as well, too, because of the ability of these big corporations and their trade groups and others to put so much money into campaigns, and the lobbying that they do is just absolutely astonishing.
It is. And as you mentioned, US healthcare is notoriously complex. It's bizarre. With that being said, have there been, since you blew the whistle and transitioned from Cigna to your new career, has there been any crazy or funny experience that you've experienced that you didn't see coming?
I don't know. I've often said that people have always asked me, do I feel threatened? And I don't think about it all the time, but I have said I usually have my wife start the car for me just to make doubly sure. But I think among the more bizarre things have been some of the encounters I've had with politicians, both on the left and the right, who just are so uninformed. It's kind of tragicomedy, I guess you would say, that you would hope that people you vote for have some idea of the problems that their constituents are facing. But sadly, not too many of them are. We are beginning to change that. But I do have a good time doing what I'm doing. I like poking the bear. I like being a David here going after these big Goliaths. And my team and I kind of have fun as we're doing this work. Our newsletter has been called kind of spicy. It's not the New York Times, but it's not tabloid journalism either. We're pretty direct and we have a point of view. So we have fun doing it.
Where can folks who want to contribute to your work or learn more about your newsletter learn more about this?
The newsletter, as you noted earlier, is on the Substack platform. You can find it at healthcareuncovered.substack.com. You can find me on social media. Usually it's at Wendell Potter. The organization that I lead, the nonprofit, the Center for Health and Democracy, centerforhealthanddemocracy.org, will get you to see some of their advocacy efforts. So subscribe to our newsletter. Check us out. We have no paywall. All of our content is free. People, fair number, are paid subscribers, but we want to make sure that everybody has access to our content without having to pay for it.
Thank you for doing that. It's these efforts that you're making and others are making that give me hope we will someday get there. It's hard to predict when, given the entrenched interests that benefit and profit from the status quo and how media can be so effectively whipped and leveraged to support the status quo. But we can't give up hope. Final question. As you think about the entirety of your career, which has had several acts, what's the moral of the story that spans the arc of your career?
Serving others is what came to mind. I came from a very poor part of the U.S., from the southern Appalachian area, grew up with people who didn't have much money. My mother always, her advice was, don't get the big head, don't forget where you come from. And I think that has been part of my story. It's been a big part of my story. I don't know that I would have done what I did had I not realized the damage that I was doing directly and indirectly to people I grew up with who didn't have much. It is just, I guess, putting yourself out there and not be so self-focused and not chasing the next dollar, but to realize that if you really want to if you want to be able to sleep at night, do something for somebody else, something that's worthy rather than just the paycheck. And also just the importance of moving beyond what you fear and being courageous and not letting fear hold you back or influencing how you think. Be aware of all the fear that's in your life and how yourself are often motivated and held back by fear in one form or another.
Well, that's really inspiring because you've had a very long and successful career, and I'm confident there'll be people listening to this who may be in a similar position to what you once were or haven't had such a long career, who can maybe take action or be influenced by what you've just shared. I find that when you look back, one common regret of the dying is not, I wish I'd worked harder for that promotion or spent more time at the office, or it's, I wish I'd spent more time with my family, done more meaningful work, etc. And you don't have to be, 70 or 50. You could be 25 and come to that conclusion as well.
Absolutely.
Wendell, thank you again for all the work you do. Thank you for spending time with us today. And hopefully this recording will add to your support. And together we can overcome the opposition to universal healthcare in America.
We're making some progress. We're going to do it. Thanks for having me on.
Thanks for listening to The Career Circus. On the next episode, we'll hear from media expert, producer, and professor, Evan Shapiro. Evan is an Emmy and Peabody award-winning producer who is now known as the Media Universe Cartographer. He operates at the cutting edge of the media landscape through his change agency, eShaft, as well as his newsletter and podcast. Tune in to learn about how Evan transitioned from NBCU executive to Media Universe Cartographer and the future of the media landscape in an AI-driven world. The episode drops next Friday. Until then, goodbye.